A treatment map is a method for organizing clinical information to match as closely as possible the needs of the patient you're working with. It is an online textbook organized by your clinical awareness and dedicated to your treatment of this patient. It represents the therapeutic process with this patient graphically and provides sections of text that you need when you need them. It differs from other texts in several ways. It provides a framework, an overview of possibilities for treatment. You tailor it to be relevant to the patient you are working with now. It is a guide to steps you can take in treating this patient. It reminds you of your choices and limitations, so you can work more freely and responsively. It does this in two ways. First, it outlines the general process of therapy for your patient and divides that process into steps. Then for each step in the process, it provides relevant text that you can use as you see fit. Psychotherapy can be represented as a sequence of decisions you make and actions you take in working with a person. Each step in the process can be represented by a box on a flowchart. When you follow the flowchart with your patient in mind, your decisions create a treatment path for that patient. The flowchart makes the choices explicit. By considering issues in an optimal order, you increase the chances that you will provide a course of treatment that will be helpful to your patient. For example, let's imagine that you are working with a 28-year-old male named Mark who admits that he drinks every day as a way of coping with stress. At some point, you may leave a session with the realization that Mark's drinking could be a source of some of his issues, as well as an attempt to manage others. Between sessions, you could look at the alcohol treatment map with Mark in mind as a way of planning future sessions. Here's an abbreviated early part of the map. To use it, you begin in the upper left corner with the patient box and follow the arrow down to box number 3. The question, alcohol misuse, means, is Mark misusing alcohol? You might be ready to answer this question now, or you may want to gather more information in your next session or two with Mark. That's your call, and it's based on a lot of issues too complicated for any text to consider in detail. If your answer is no, go to point S on map 1A, which will suggest that you move on to deal with other issues, possibly alternative ways to manage stress. If you think that Mark is misusing alcohol, then return to the flowchart and follow the arrow to the right to box number 4. There's a reason that each of the boxes on this flowchart are numbered. Each box corresponds to a section of text that explains what it means and how you handle that piece of the therapy. So, if you can't decide whether Mark is misusing alcohol or not, go to section 3 of text. In a few minutes, you can be clearer about the question and how to answer it. Then talk about the issue with Mark, a process that could take from a few minutes to several sessions. Here's a brief summary of the topics covered in Section 3. It contains information about the use and misuse of alcohol, information bearing on your decision about this patient. It helps you make a partial, focused diagnosis that allows you to move on with Mark's treatment. That's all that Section 3 does. You don't need a full battery of tests or review of all possible medications at this point. Maybe later, maybe not. Let's suppose that you do gather some more information, and it seems likely that Mark is misusing alcohol. Next, you have to decide what kind of misuse. If you already know how to work with this issue, you can gather more information in session and answer the question. If you're not sure about how to proceed, you can go to sections 4 and 5 of text for help. The text in section 4 begins by giving criteria for evaluating a person's level of dependence on alcohol. It then distinguishes physiological dependence from psychological dependence and discusses symptoms that a person is in withdrawal. A definition of abuse and symptoms of abuse are discussed in section 5. Your decision at this point will affect the further course of treatment. Not only are you choosing a treatment path to follow, you are also deciding on information to ignore for now. For example, if your patient is psychologically addicted, more information about physiological addiction would be consuming your time, distracting you, and possibly leading to wasted or harmful treatment. The flowchart gives a broad perspective. That's useful. But the price you pay for an overview is detail. You just can't get a lot of information into those little boxes. They are abbreviations or reminders, but that's about all they can do. That's what we need text for. It is important to know and remember what those little boxes mean. In a treatment map, we have a section of text for each of the boxes on the flowchart. The text expands on the abbreviation in the box. A section of text can be any size, from a single sentence to a paragraph, a page, or 30 pages, so long as it is focused and relevant to the box it is explaining. Section 3 of the alcohol map is the equivalent of about 4 typed pages. Here's what part of the actual section looks like. What you do with the maps is up to you. It is only a textbook and can't replace clinical intuition or judgment. It is, however, a textbook designed for psychotherapy and not focused on the history of psychology or the findings of research or pumping facts into undergraduates or other academic pursuits. You may make different choices for the next patient, linking together different sections of text to create a different textbook. Sections 3, 4, and 5 are all shown on Map 1B of the Alcohol Treatment Map on the other site. You can stop this presentation at any time and go to the full map by clicking on the links below the video. Once you get there, you will see 2 things immediately. First, there are additional steps to consider in early alcohol treatment, most of which involve gathering information about the patient or making choices about the kind of treatment the patient needs. Map 1B includes a couple of steps that were omitted from the flowchart presented on this video. Second, on the other site, it is easy to go back and forth between the flowcharts and text, so that the 2 forms of presentation are fully integrated. In fact, flowcharts and text appear on screen at the same time, so you can see the relationship between them more clearly. The more you use the maps, the more familiar you will become with the choices and directions they contain, and the less you will need to refer to the maps at all. At present, there are treatment maps for some of the broader and more common issues that therapists face in private practice. They include dealing with a new patient, working with an alcoholic patient, working with a patient who is anxious or who has panic attacks, working with a patient who suffers from depression or grief and loss. The material has already taken some form and can be helpful. Feel free to use it within the terms of the contract. The maps appear on the other site, treatmentmaps.net. A link to that site appears in the text below this video. A number of therapists have contributed to the treatment maps so far, but there is much that can still be done. The present site is devoted to finding ways to expand and improve the maps on the other site. Please have a look at the maps that are already available and see if they are helpful in working with patients. Where they fail, send in suggestions for improving them. Suggest new directions or new interventions. Suggest different approaches. Also suggest where and how your suggestions can be incorporated into the maps.